Hi, I'm Robin. Presentation's fundamental idea is to question Western culture's tendencies to hold rigid views regarding gender and biological sex, and to begin to critically think of the cultural context when assessing and aiding individuals and families seeking support and information on gender identity concerns. First, let's define Western culture. When we use the terminology Western culture, we're referring to the views held by the majority and which follow the culture of European descent in North America. Indigenous populations are not included in this group. In regards to gender models, the heritage of social norms adopted by the West is a strict understanding of a relationship between sex and gender. Sex is in reference to the results of biology, such as chromosomes and anatomy, and gender being the socially constructed roles and cultural representations associated with that biological designation. In the traditional Western model or culture, there are only two options, or binary, female or male. Simply put, if you are born with two X chromosomes, you are expected to develop a female body, identify as a woman, and act in line with a feminine stereotype. While individuals that are born with an X and Y chromosome develop male bodies. They must identify as men, and they must act in line with masculine stereotypes. When understanding why these strict relationships exist, you could look at social role approach, which attributes the sources of gender role beliefs to the different social roles performed by men and women in history. But quite likely, those roles are no longer needed or no longer exist. For simplicity's sake, we are going to look at this in three sections. First section is our patient. Our patient has gender identity questions. We then look at the Diagnostic and Statistical Manual for Mental Disorders used often as a Western-based assessment tool. And then we look at the diagnosis that results in both of these factors. This model determines that gender variation or gender fluidity by definition is pathological, and it reinforces a binary gender model. Gender identity disorder, or more recently termed gender dysphoria, according to the Diagnostic and Statistical Manual of Mental Disorders, is defined as a marked incongruency between their experienced or expressed gender and the one they were assigned at birth. More simply stated, their chromosomes that they were born with did not sufficiently enable them to fit in within the socially constructive gender norms of Western culture. In a review of the DSM diagnostic category for gender-related distress disorders, it was stressed that its origins are linked between the psychiatric diagnosis and treatment of childhood cross-gender behavior as a way to prevent adult homosexuality. Societal norms in Western culture follow the binary model. However, progression is being made, and more terminologies are being learned and followed. Terminologies such as gender variance, a description of behavior or gender expression by an individual that does not match masculine or feminine gender norms, and non-binary, or genderqueer, a spectrum of gender identities that are not exclusively male or feminine, identities that are outside the gender binary, and gender fluidity, which is in reference to non-binary gender identity or gender expression that is not fixed and is capable of changing over time. Additionally, this rigid view of gender is not a reflection of the global community. History around the world tells of non-binary identities. Here is a small list of just a few of the non-binary identities that exist around the world today. Consider Canada. In 2016, the Canadian Census reported that 250 ethnic origins are identified within its people. 4 in 10 people reported having more than one origin they identify with, and not all of those origins come from countries of Western culture backgrounds. Let's consider the case study of Michael, a 6-year-old boy living in Australia. Australia is a Western-based cultural country and follows the binary gender model. Michael is being assessed for cross-gender identification behaviors due to his behaviors being more feminine and often dressing in a more feminine manner. He is being teased at school and his grades are dropping because of this. And the school finds it difficult to talk to the parents, as the parents do not discourage cross-gender behavior. In fact, Michael's family has a positive view on gender transition and acceptance of a third gender, as per their Thai culture. In a clinical setting, the DSM would suggest that Michael has gender identity disorder or gender dysphoria. Culturally, Michael's behavior is not considered a malady, where gender fluidity in Thailand is well accepted as a societal norm. In Australia, Michael is being bullied for his behavior and is suffering from psychological effects. Therefore, treatment would have to be made more tailored to Michael's cultural background, yet current presentation. Cultures around the world will show a variance of their definition of gender roles and how they relate to biological sex. Some cultures will determine gender based on religious ceremonies. Some cultures will determine gender by behavior that is shown at young ages. And each culture shows a varying degree of tolerance for what they consider atypical gender behavior and gender fluidity, which is why an understanding of cultural context is so important in the clinical assessments of any gender identity concerns. It is valid to question why we still use this system in Western culture. And the reasons are not simple, but simply put, gender dysphoria and GID still exists. And regardless of a person's own cultural beliefs, they are still immersed in the Western model of gender. They will still need to function and ideally thrive in a school system with peer groups and in general society that predominantly follow the binary gender system.
Created using Powtoon.